I was surprised that many patients don't even know that their bills are wrong or that their bills can even be reduced.
This is the co-founder and CEO of Truffle Health, Rui Maki. She's using AI to improve the American healthcare experience. Her platform, Truffle Health, has helped users save over $10,000 in just one sitting. We asked Rui about what it takes to compete in the healthcare industry, entrenched with misaligned incentives, and her vision for redesigning healthcare in the US.
Thanks, Leon. Thanks, Antonio. Thanks for the introduction.
So happy to have you, Rui. Really excited to talk about you and Truffle Health. Before we get into Truffle Health, though, we would love to kind of talk about your background a bit. What was it like, being a researcher? Tell us about yourself.
Yeah, of course. So to give some context, I'm from Vancouver, but I was originally born in Japan. And I met Leon when we went to high school together in Vancouver.
Go Canucks.
Yeah, Canucks. And essentially, I went to Cornell so that I could be pre-med and become a doctor. That's been my dream since I was 5. And then as I was learning about the U.S. healthcare system and learning about key patient concerns, medical bills and the billing system in the U.S. repeatedly come up where patients will get a bill, say, months after they get care. It's very confusing which each of the line items are. And essentially, I became very passionate about a patient's problem in healthcare in the U.S. But I'll go back into my background first before we dive into the startup. So I was at Cornell and I was completing different research projects, especially in healthcare. I've always been very interested in the sciences. I was doing research in a biomedical research center, and I was also at a research lab that's focused on cultural psychology. It was really cool because as a Japanese person coming in to Canada and then to the US, there's like two different types of cultures. There's like the interdependence versus independence, American culture. So that research lab really clicked with me in terms of figuring out my identity, exactly what I wanted to do with my life. And I realized that I was really passionate about just helping people specifically around healthcare. And so I was at Cornell and I was doing different research projects, and I came to realize that I was more interested in macro level ways in helping people, because I was doing all my pre-med courses. I was doing organic chemistry, biology, biochemistry, and all these weed out classes. And the classes that I found really interesting were the ones that talked about population health, like global health, not just specifically healthcare systems in the US, but how patients are affected all over the world. And I actually ended up doing a bunch of development work in Peru as well as in India.
Wow.
Okay. And then I was working at the WHO in Switzerland. Oh, wow. So it was just traveling around, learning about different healthcare systems in the world. So hopefully take these insights back, bring it to the US, to Canada, North America. And yeah, so that was my first entrance into the healthcare system, and then learning about the different healthcare systems around the world.
You worked on so many healthcare jobs and opportunities. What were you always aimed to go to entrepreneurship? Was your goal always to be a founder yourself?
Yeah, I would say that always really intrigued me, being a founder. I did have a deep goal or a dream of being a doctor since I was really young. But then I think that entrepreneurship was something that always actually really excited me, but I just thought that was something that wasn't feasible for me at the moment, because I was so set on this pre-med path, and I thought that was something that I would just do later on once I'm already established myself in my career. But then I realized later that the best way to learn about entrepreneurship was to just dive into it and do it. So that's how I really decided to get into it. But yeah, basically, I always was interested in it, was curious about it, but I didn't think it was feasible for me so early.
So did you think that you wanted to be an entrepreneur before or after you met your co-founder?
It was around the same time.
Okay.
Yeah, so after I did my healthcare experiences, I did my master's at Cornell Tech, which was on Roosevelt Island in New York City, right in between Manhattan and Queens.
Got it.
And they have a very entrepreneurial focused program there. So they were encouraging the STEM students, the tech students, to get into entrepreneurship. And so I was looking for a co-founder there. And then I was also thinking about potential ideas that we could pursue while we were at our master's. And then it was very serendipitous where I met Christian, and he had broken his kneecap and was coming from Iceland. So he's also not from the US, and he's used to a more like streamlined universal healthcare system. And then he was really surprised by all the different billing complexities a patient has to deal with here in the US, and was very surprised by that. So we realized that this was a problem to be solved, and we connected over that shared experience of not being from the US and being used to different healthcare systems. And yeah, we also just bonded over the fact that we like enjoyed doing our homework. He was like always nerding out on his homework. And then I just thought that he would be a really great co-founder because he had so much like happiness and passion when he was doing his homework. So
Wow.
I thought that would probably apply well for when we're doing the startup together.
That's so amazing. I mean, if you see yourself having a, happy friendship with someone, while doing your homework, I think that that's a pretty good arbiter of whether or not they would be a great co-founder. And, to see that that's how this all got started is amazing. I have to ask for a bit more detail, I think, on the broken kneecap, though.
Yeah.
I think I would really like to know, let's just say this very simply. Do you think that you would be here, or that Truffle Health would be where it is, if Christian does not break his kneecap?
Ooh, that's a good question. I think he was also very interested in entrepreneurship and in finding a problem to solve in healthcare, but also in other bureaucratic systems. And I think that having that experience, it put him in the perspective of the patient. Otherwise, it can be hard to relate since he is international as well. But at that time, we were doing customer discovery, and we were interviewing a bunch of potential customers that we wanted to help, and we were interviewing patients. And then a running joke is that a lot of our advisors say that I intentionally broke his kneecap because we wanted to do more customer discovery. But actually, he broke his kneecap while he was playing soccer.
Aw.
Yeah.
Wow, that's amazing. I mean, I think this also like showcases, I think this is a really good story that's like shows just like how grad school can actually still foster really great, relationships with people. A lot of people think that maybe Leon and I met in undergrad, and, have a lot of wonderful friends and, from that era. But I think that, grad school is still a great opportunity to meet people, especially in the context of meeting your co-founder. Because when you're meeting your co-founder, you want to find someone that is going to have the specialized knowledge that you seek. And grad programs are primarily specialized. And so thinking that through, I think that really makes a lot of sense. Could you maybe elaborate on that a bit though? Like, what was it like being a grad student and also, doing that initial customer discovery at the same time, balancing school and your startup?
Yeah. I mean, I first entered into grad school because I wasn't ready to be a doctor, actually. I wasn't ready to graduate. I was in my senior year at Cornell, and I just realized that I didn't want to be a doctor anymore, that it wasn't the right path for me, and I wasn't ready to take a job either. I didn't even know what that job was going to be like, so I just thought I wanted to, have some more time to figure out exactly what I wanted to do. So then essentially the Cornell Tech program is a technical program. So it's a information science, computer science program, but with a concentration in healthcare. And I just thought, okay, I think being in the technology space will be relevant for me. Just, with all these advancements in technology, I think it would be good to be where the future is. So I decided to do a technical degree, and really it was just to buy myself more time so that I can figure out what I wanted to do. And yeah, as I was learning about different opportunities that incorporated technology, and then met Christian, who actually did his bachelor's in computer science too, and had more of a technical background. And we realized what was feasible in terms of innovating in the space. So that was very cool.
You bring up the concept of going to grad school effectively, perhaps to maybe buy some time. And I would actually like to advocate for that a bit. Grad school is a really specialized experience. I think there could be a case made that I also have gone to grad school to buy time. And in the end, universities just have so many great resources that you just wouldn't get somewhere else. And so your kind of capability of growth, especially if you're a potential entrepreneur, your likelihood of success of at least getting something off the ground increases exponentially just by being at a university. So yeah, if you can find a way to get there, if you can get a great scholarship to be able to make it happen, going to grad school to buy some time, especially when you want to work on a venture, really maybe isn't that, terrible of a path to extend your education.
You spoke about your entrepreneur program was pushing you to be creative and pursue entrepreneurship. Can you tell us the early stages of what Cornell helped you bring and how you ideated to become Truffle Health?
Yeah, we have a specific program at Cornell Tech. It's called Studio, and essentially it's called Startup Studio, and essentially it's all about creating a startup, and then you form a team with other people who are in the year that you're in. So myself, Christian, and we actually had a few other members of our team too. We all banded together to be a group and go through Studio. And we had ideas that we wanted to spin out or essentially like continue on the project full time. But at the time, it was more of a class project. And then we were going through the customer discovery phase and learning about different people's programs. So that's how it first starts. You try to do at least like 10 interviews a week, just reaching out to different people and finding a problem that you can solve. And then as the semester goes on, then they'll tell you to narrow in on a specific pain point and to start thinking about a solution for that. And then afterwards, actually, students or like specific student groups will go and try to do a big pitch and then try to get investment from Cornell. So we went through this whole process and with our startup team, and we ended up interviewing, I think, like 100 to 200 like patients, doctors, nurses, EMTs, various different people in the healthcare space, and learning that these medical bills were a very big problem, and they were viscerally just describing about the huge problems and pain points in their personal lives around it. And we realized that there was an undermet and underserved need in this specific place. And then as we dove deeper into it too, we realized that it is also the number one reason for bankruptcy in the US.
Oh, wow.
And there's a bunch of errors on medical bills that can be negotiated that many people don't know about. And then yeah, on top of that too, there's actually been like recent legislation, like from the Affordable Care Act, from Obamacare and onwards, there's been a bunch of new legislation that's promoting data, new data, like public data, price transparency, interoperability. And that's becoming a really great catalyst for innovation and specifically technological innovation and taking all this new public data and using it in a way to help patients. So we just got really excited about this opportunity. And actually, I wanted to get a job initially when I started grad school. I was thinking, okay, my dream job is I would love to be a PM at Google or something.
Okay.
But then I got so excited about this opportunity, I like really fell in love with my team that we decided to do it full time and just dive into it.
Wow. It sounds like you didn't just do customer discovery, but you also did a lot of problem discovery. Like you just rattled off like so many statistics that just make the case for a company to kind of come in and perhaps, change the way that the landscape works. And I think that, people talk about, talking to users, which you absolutely need to do. But you can't just talk to users and, think that, the problem that you think they want to solve is the problem that your business is going to solve. You have to kind of talk to them to kind of even discover what that problem is. And it seems like you all really did that. I think it's time now to get into what Truffle Health specifically does, though. You've outlined your customer discovery, outlined your problem discovery. Let's kind of get into what Truffle Health does.
Yeah, so Truffle Health is a AI-powered patient advocate, or you can think of us like a TurboTax for medical bills, where we'll guide patients through the process of understanding and reducing your medical bills and just taking the complexity out of that.
The TurboTax of medical bills. I love that. I love a great comparison. TurboTax sometimes, maybe has a reputation for perhaps maybe not being as clear with its users as it could be, though. There's a little FAQs that are on the side, but sometimes people can mess things up. How could you get around that for your solution that you're building?
I think the part about the TurboTax that we like is that it's like taking the complexity and the stressful nature of doing your taxes. And I would say like addressing the parts where sometimes they can be more, not transparent.
Yeah, of course.
Yeah. Like for us, like that's the main thing. Like this whole new wave of healthcare that's moving forward is towards transparency. And that's like one of our core values. And we aim to be transparent by, like being transparent with the medical bill. Like we want to tell patients exactly what they're being charged for, like why each of these items exist. And like what they can do about it so that they know what their rights are, they know what they can do with every medical bill that they receive. So transparent in that regard, but then also transparent in our own practices. So with our own practices, we're very transparent about like pricing. Actually, today we are free, so like they can just tip us
Free.
for what they want. Yeah, because we're still actually in like beta, so we're testing with our users, and that's more important, that we're building a product that users really love. But in the future, we're thinking of a subscription, and we're very transparent about that with our FAQs, but also just in our privacy policy with how we collect a patient's data. We're HIPAA compliant.
Wow.
And then if at any point in time a user wants to delete their data or delete their account, they can do it really easily anytime.
Wow. And so I'm interested more, on how you said that the company is currently in beta, right? Maybe we can kind of define what it means to be in beta, and, when do you think, hypothetically, what are some milestones that you think you'd need to reach to perhaps get out of beta?
Essentially, it's just a more robust product than an MVP.
Got it.
Is really it. Like, we built our initial MVP, and then we tested it with our users, and we were able to make the features more reliable. And then, so that's what we define our beta, just a level up from an MVP. And we're not yet public because we really want to make sure that our product is reliable when we do launch it to the public. So we're testing it with our users, letting them use it for free and seeing if it will really help, because we only really want to release it out if it's truly helpful to them in their medical bills.
Can you possibly give us a walkthrough of what a customer experience of using your app would look like?
Yeah, so they can first sign up, and then they can link their health insurance. But if they don't want to link their health insurance, they can go dive right in and upload a medical bill, as well as an explanation of benefits. And essentially what happens is that we'll take the medical bill that they receive from the hospital or provider, and then the explanation benefits or the claim if they link their insurance. And then we'll find discrepancies between the two. And we'll catch any errors, overcharges on their medical bills itself. So some examples can be, there can be an inflated charge. So as I mentioned earlier, there's new legislation that requires hospitals, insurance companies to provide pricing on hospital care or their health plan negotiated rates. So now, utilizing new public data, we can tell patients, hey, this item that you got at this hospital with your insurance is at a much higher price than is publicly listed. So then they can, we can reduce that and negotiate that down. Another example that's pretty frequent is like upcoding, is essentially like exaggerating the charges that you get. We often hear that, sometimes patients, you'll go in for like a 10-minute consultation. Maybe they'll give you an Advil, but then you get a $500 bill or something like that. So that's something that happens quite often too, these exaggerated charges. And then by providing patients with a clear understanding of exactly what has happened, they can also identify what's exaggerated and what's not. Yeah, I can dive into the many different types, but
I'm like actually kind of like shocked that this is even possible. I have to be honest, right? Like we're talking about this, like it's just the status quo. Like, yes, it's okay. The hospitals, they overcharge, it's fine, but I mean, it doesn't seem like that should be the case really. And so, this kind of really opens up the opportunity for you all. I'm curious in like how this relates to your business model, right? Because hypothetically, maybe you could actually come in and maybe help them make less mistakes and like address this from like the B2B component instead of like working with consumers. Or is there like an incentive that would kind of make them not want to actually work with you?
Yeah, there are some very weird incentives in the healthcare space, which is why it's almost structured in this way. And so our mission is to be very patient focused and to help patients through all of this. Just with the incentives in play, an example is a fee for service model. Doctors, they can get paid by performing more procedures, doing more things to the patient. They get monetarily like more money for doing those things. So they're incentivized to do more, even though maybe that's not as helpful to the patient. And then similarly, on the insurance side, there are some incentives there to deny claims and to like deny the amount of coverage. And so all of these weird incentives at the end can really be at the expense of the patient that then gets left with this super high bill with errors, overcharges. And some of them, it's not even errors. There's like a bunch of fraud in the industry too.
I don't like to hear about fraud, especially in an industry like healthcare, where people's lives are literally at stake.
Yeah.
So, I mean, it feels like the stakes are really high in this industry, and I'm really glad that you've chosen to kind of address this.
So how do you prioritize data security and patient privacy, seeing that there might be some fraud? You worked as a patient privacy researcher at Norton LifeLock. How did that experience translate over to Truffle Health at the moment?
Yeah, so we are HIPAA compliant, and then we make sure that, like anything that we do with the patient's data, it's only just to help them with their medical bills, catching errors and overcharges. We only get the information that we need to do those things for the patients. And if at any point in time they want to delete their account, they can delete it. And yeah, it only stays within them. So that's the main thing in terms of my prior experiences. Sometimes some scams out there in terms of healthcare. There might be fake health insurance scams. They're trying to sell you something that's not actually legit. I guess for us, we're just really interested in building more and more trust with our patients by being very transparent with everything that we do, so that they can work with us and we can keep helping them with their bills and protecting them from all of these things.
So you're demonstrating a clear understanding of what a patient that is utilizing Truffle Health can expect while utilizing the platform. I am curious as to how you approach turning those observations into the creation of a tech platform, though. You were a product manager before. Do you think that role is what has propelled you to maybe create this, be able to create this platform and kind of understand the user, rather not only understand the user, but also create a technology that they can utilize to reach the goals that are important for them?
Yeah, I would say that an accumulation of all my experiences has helped me in developing some skills and helping, to really create this product that would help patients. I guess a product manager role, the main thing is that, you got to really listen and empathize with the user, empathize with their needs and what's going on. So then understanding and seeing repeated pain points, then translating it into some product. So then you have your initial first MVP, maybe some wireframes initially, and then you just keep testing that and iterating that with users and seeing if that's actually helping them.
And so when you're looking through those kind of initial iterations of the product, what was maybe the biggest surprise that you had that you didn't expect when you were trying to build this product initially?
Yeah, I think that I came into the US to study healthcare, so I became fairly knowledgeable. I started to understand more about why the landscape was the way that it was, and I was surprised that many patients don't even know that their bills are wrong or that their bills can even be reduced. So I think just that piece was very surprising, and just putting myself in their vantage point. I mean, when I really think about it from their perspective, why would they know about different healthcare terms? No one is telling them what it is. Doctors also aren't telling them. And why would anyone know, say, what a deductible means or a copay, co-insurance? These are all medical jargon that a patient shouldn't really be expected to understand. But now it's by having this understanding and knowledge on their health insurance or healthcare, they can also save a lot more money and be more empowered. So that's what we're trying to do.
Yeah, I'm not really seeing as much of an, so there's the efficiency gap, of course, but there's also the information gap.
Yeah.
And, that is definitely shocking that, people aren't kind of even able to define those terms. And I don't blame them. I'm American. I'm the American on this panel here today. And we do not have healthcare class. We have science, we have biology, right? And you guys probably didn't either, but the context of that being, important for us uniquely because we do not have a single payer system, I think is really relevant. And so, just hearing that you're kind of creating a business that's not only seeking to empower patients, but also to inform them, I think is really inspiring.
Given your background in studying healthcare and coming from Canada, what are the barriers of entry that you see that is affecting the current state of healthcare in America?
Yeah. Do you mean barriers in entry for someone to get started in innovating in the U.S.? Or?
You mentioned previously the lack of knowledge and education, like Antonio said, lack of lingo, understanding. What other barriers of entry do you think is influencing this lack of literacy in healthcare?
Yeah, I think there is just general lack of education in terms of the healthcare system. And so there is one there, but also say a patient actually really needs healthcare, goes to the emergency room, or that probably means that they're in a state where they're not really mentally available fully to be learning about all these terms and their medical bills as they're getting medical care. Like when you have a chronic health condition or you receive an injury, like Christian, he had his like kneecap injury and he went to the emergency room. Like he's just thinking about his kneecap and what's going to happen to his knee. Like, does he need to get surgery or anything? Is he going to be able to play soccer again? Like that's the main thing, and that should be the main thing that he's focusing on. But then in the US healthcare, it's like to not be ripped off really, like, and to really be on top of things, you also have to think about, but I want to make sure that I'm going to an in-network doctor, not an out-of-network doctor. How much is this visit actually going to be? Like, do I really need to get all of these necessary procedures? Is it really necessary? Is like, should I really be trusting my doctor? And I think that's what the billing system here has created like a lack of trust sometimes with the patient too.
I mean, I'm not just seeing a lack of trust. I'm seeing an incentive for misinformation. I mean, that's what it's getting at, right? It's that when somebody's not as informed, you can take advantage of them. That just messed up, that on so many levels. To kind of like take it back to like how you were able to get this business off the ground, where did you get, your kind of initial passion for healthcare from? Because I know this is kind of maybe taking a step back from everything, but I'm just seeing that, maybe you can even just walk through your experiences in Canada or anywhere else that you were, and how that kind of is different from the American system, because I'm seeing like a real passion about this space that feels like innate in a lot of ways.
Yeah, when I was in Canada, and I just really fell in love with all my science classes, is just how it got started, and just utilizing science or healthcare as a way to help people. I just thought that was all very, very interesting and very like intellectually interesting to me to learn about. So that's, I think, how it initially got started. I also think that like when I was younger, like my sister also, she has like asthma and she has some chronic health problems, and she went to the emergency room a lot, and I often spent a lot of time in the hospitals there, and that was always meant to be a safe place, a happy place where you're getting healed and you're getting better. And then so I think that's what attracted me to the space initially, because I wanted to be one of those people who could create happiness and healing in other people as well as, and I also just really liked science. So I started off being pre-med, and then just learning about how the healthcare system itself is set up in the US, I just became slowly kind of angry at the injustice of like, there's like fraud and like people are being taken advantage of. And I think that made me like ignited some kind of fire where I really wanted to help people in this space. And I thought it was also just like a really great opportunity itself. It's a massive market. There's like a lot of people who do need help in this space. And I thought that I could do something in it. So now I'm just trying to do something in it.
You're currently focused on healthcare, but do you eventually see Truffle Health go intertwining with the pharmaceutical industry?
Maybe, yeah. I think we think about things in terms of the user experience. So I would say that with some patients, they want transparency in terms of hospital care, but they also want some more transparency in terms of the medication that they receive. So I can see some angle there where we would also give more transparency there and then help them to maybe like reduce their medication prices, not just their hospital prices. Okay. But right now we're primarily just focused on hospital care and medical care.
Okay. If we can move on to the business model, you recently said that you are on a tipping trial model. What made you decide to go to that model, and how do you expect to do that for the future? When do you plan to pivot from that?
Yeah, right now we're just mostly focused on iterating with our end users, just really understanding what their needs are and developing the product. And tipping is more just a signifier of perhaps that what we're doing is valuable to them, and it's like a signifier of potentially what the product could be worth. So we're in the early stages of research, and long term, what we're thinking is actually going more of a B2B angle, and then like perhaps incorporating the product into a person's employee benefits package.
Oh, wow. That sounds brilliant. I get that. I brought up before the concept of, maybe trying to integrate with the healthcare systems. But if that's too difficult of a market, if that's too entrenched, then that's the way where you could really, you could really have a lot of impact through then. Yeah, you can find a way to sell, do like a very typical kind of like B2B SaaS sales cycle, and then kind of move into, being able to assist people with their individual claims as well through the application, right? So it's not just, the sales process doesn't just become individual like it is now perhaps, but you would have that concept of working with businesses and then also being able to get into, the consumer space as well.
Yeah. And actually, a really interesting thing is that many U.S. employers are self-insured. And what self-insured means is that they are actually the ones that are paying, like from their own, like they're paying the medical bills of their employees, especially when the employee size is, say, like 500 or greater. It makes more sense for them to take on that risk pool.
Oh, wow.
And then so they're essentially almost like an insurance company, and then they're paying the medical expenses of their employees. So there is an incentive there. They're also like looking for ways to save money, cut costs, because essentially it's like their money that they're helping to pay for the employees' medical costs.
You said you're from Canada.
Mm-hmm.
You went to study Switzerland. You went to Peru. How can America healthcare learn from them? Bits and pieces of their healthcare and what? Yeah.
That's interesting. What can they learn from them? I think it is like different philosophies.
Mm-hmm.
America has both. There is like the government intervention when it comes to healthcare, but there's also more of a capitalist sense. There's private and public centers of healthcare. Whereas in, say, Canada, Iceland, or so, it's single payer. So there's one entity that pretty much distributes health insurance to the citizens and also negotiates different medical care prices. So, for example, Canada actually negotiates with pharmaceutical companies in the US for pharmaceuticals for their citizens in Canada. But because there's just one entity negotiating, they're able to drive down the prices because it's like, okay, take it or leave it. We want the drug at this price. Whereas, say, because in the US, there are so many different entities, different health insurance providers and hospitals, they have like less negotiating power. So actually drugs that are manufactured in the US are way more expensive in the US than they are in other places in the world. So yeah, this like decentralization and public and private parts of healthcare is what constitutes the US healthcare system. In terms of lessons from outside, it's very hard to say because of like how the system has already been set up and how it's very entrenched. But I would say like more emphasis and a care towards patients would be very helpful, because in the US, medicine is very reactive. It's like you get medical care when you have the illness or you like something bad has actually happened. But when you treat patients on more of a preventative level, it's also much cheaper too. And in the US also, healthcare outcomes are not that great in comparison to other countries that are also similarly developed, and they pay way more in healthcare. So I would say more of an emphasis on preventative care, more of an emphasis on like patient orientation rather than profits.
Understood. So clearly the U.S. has a lot to learn. But I'm someone that likes to think of, problems, especially in this country, with a bit of a positive spin, right? So let's try to get some patriotic positivity here, I would like to say conversely, is there anything you've seen that, and the answer could be nothing, honestly.
Yeah.
Is there anything you've seen that maybe the U.S. does better in terms of healthcare compared to other countries based on the work that you've done so far?
Yeah, I mean, I am here in the U.S. for a reason. It's because there's also a bunch of innovation in the U.S. Because there is the private sector, public. There is also a lot of room for innovation and for people to make new changes. Whereas in other countries, it's very hard to innovate in healthcare. It's just like a bureaucratic government system.
Right.
So I would say that the U.S. does a really great job there, and in encouraging that kind of innovation too. Other things, I would say, probably mostly that. Yeah.
You spoke about innovation. The U.S. Healthcare is progressively developing, but there's still many challenges that are difficult to solve, such as some notably like insurance is often tied with employment, inadequate or no insurance sometimes. If you were to redesign or reshape the American healthcare system, what are some points that you would probably want to implement?
Where would you start? Let's start with where you would start. That's a large question. So what would be some of the first things that you do?
So is it redesigning it from scratch or redesigning it from how it is today?
Let's go with a kind of exploratory perspective. You can redesign it from scratch. Why not?
From scratch. Okay. Probably, if they were to do it from scratch, probably want to mimic other countries like Canada, or so, like have it more of a public sense, like not have so many different entities. Because in the US, it got started primarily because of like World War II, and then they wanted to provide some incentives for people to like join the war efforts and everything. And then suddenly it got tied, like health insurance got tied as an extra benefit with employment. And it's kind of just stuck on since then. Like really the healthcare system, how it is today, has really just been around for like less than 100 years. So it's fairly new, you know? And then on top of that, with these private health insurance spaces, then there's all these additional new administrative burdens that where you need to file claims so that hospitals, doctors can get paid. So if there was one way to unify it all and centralize it, I think it would create a lot less administrative headache and burden. I'm not saying that like Canada is like amazing because also there's some problems there too in terms of like really long wait times. Maybe there is like more of a lack of innovation in other countries in comparison to the US, and they do spend a lot of money there. So I would try to keep those innovative components, but keep billing to be one standardized, like one unit, maybe probably the government in taking over it so that there's also less fraud and
Yeah, I think that makes sense. I mean, also like a culture change, I think becomes relevant as well, Rui. You know, Rui said something that I think was fascinating, which was that she used to see hospitals as a place for happiness and healing. HHH. I won't forget that. And I think that that's not what people feel when they enter a hospital right now. People feel stressed. They feel burdened. They feel like they're going to be charged literally potentially $1 million for something. And they're usually there for a reason that's perhaps not their fault. And I think that context is just so important that even like a culture change from the bottom up. I mean, we're also talking about, you know, misaligned incentives is one thing, but also just like straight up the lack of like billing properly. And like that's only possible with a culture that frankly could be predatory. And so that kind of capability of like addressing the system by utilizing other nations' backgrounds and also maybe considering like, hey, we could even have a culture change. I think that's, you know, really important as well.
Mm-hmm.
One of the hottest topics nowadays is artificial intelligence. How does that work with your product right now? And what potential features and future capabilities do you envision incorporating into the Truffle Health product?
Mm-hmm. Yeah, today we use AI to extract key terms on a medical bill, and then so like using OCR detection. And then we also utilize it to find billing errors, so something that commonly comes up, and then we'll just keep training our algorithms with new data to find new errors. So that's the way that we utilize AI today. We also utilize it as a way to describe the medical bill, especially like with OpenAI, they're really good at, with their APIs, they're really good at explaining things in a conversational format in plain English. So we utilize their API to explain the medical bills in plain English to patients. So that's how we utilize it today. I think that just in the healthcare industry, it's ripe for technological disruption. There's a bunch of manual processes that don't need to be there. There's many different areas in which you could utilize AI for healthcare, not just in, say, there's a bunch in billing and in administrative tasks, but also in delivering healthcare itself too. So say, I've seen like a few applications itself where it's like you have many different like X-ray images of like different imaging and the diseases or the things that you're trying to look for within those images, and then training a model with those images so that it can more accurately identify a specific person's ailments, like when the person gets an X-ray. So like that's one area that I've seen be done. Another is very cool. It's like, you know, like wearables. I've always found that to be very interesting to say a wearable will detect your biometrics and the baseline. So say your baseline breathing levels or like heart rate and everything. Right. And then it will identify when something's a little bit weird and basically tell you before you are about to get maybe a stroke or like maybe get some kind of like health problem or heart condition, and then you can be rushed to the hospital before that even happens. So I've always found that to be really interesting. But I think the consensus too is that healthcare is also a space where you want a personal touch. You don't want just like to be interacting with a robot, and you want someone you can speak to and empathize with. So I think there will always still be a human component or element, unless like AI is able to also replace like the empathetic nature of healthcare too.
Yeah, I mean, the vocal element I think is important, right? Because people have just like such specific questions about their health, and they want to be able to ask the questions not only in a way that they can get the answer that they need, but they would also seek answers that are culturally responsive. And I think in a country, especially as diverse as the U.S., I think that that's super important. Kind of getting into that elements of things, how could you expect your work with Truffle Health to continue to be patient-centered moving forward, right? Are you going to continue to test out the products, as before you launch new features with a set of potential users? Are there going to be partnerships with potential places that, have a set of patients that are ready to test out something like this? How could you, kind of make sure that your products are continuing to be responsive to the needs of patients moving forward?
Yeah, it's exactly how you said it. We've just continued to design and iterate and test our product with patients, just putting the patient at the center of everything. That's really how we do it today. And then when we have a product, we always just make sure to test everything out to our group of patients, and we're continuously always recruiting new patients to test with.
Amazing.
To follow up on future plans, what are some of your personal goals or goals you envision for the company potentially in the next 5 years, next 10 years for Truffle Health?
I would like us to be a brand that patients can trust, that it's the go-to brand where when a patient thinks, oh, like, what do I do with my medical bill? Or like, what should I be doing with healthcare? How do I navigate the healthcare space? They think of Truffle as that trusted entity that they come to and can ask any questions with.
Okay. And we're slowly going to wind down. One of the things we ask is, what are some of the success stories and memorable moments of your journey so far? And if you could share with our audiences.
Yeah. I think at the time when Christian broke his kneecap, I also had a medical bill too. It was just a flu shot, and it was supposed to be free. It was covered by my school, but then it was sent to debt collections. And I was very scared about that at the time, and I didn't know anything. And I had learned about all these new principles about ways in which you can reduce your medical bills and all the different types of errors you can catch. And then I was really nervous, and I was calling the debt collector for the first time and then negotiating with them with all these new principles, and then negotiating with the hospital. And then it worked. It worked. They
Wow.
wiped the bill, and then it was covered. I mean, it was meant to be covered, but I just didn't realize that like a patient has more pop than they really think, because I really thought that I had to just pay it off and just get it over with. But I didn't realize that you could speak up and negotiate it and reduce it. And then similarly, then we were helping a patient and seeing if we tell them these different things. So we had one patient who, she got a medical bill, and it was not very clear at all on her portal what was going on, and it was charged for $500, but it was a very simple, like, 10-minute visit. And then it turns out that she went to an in-network provider, but it was an in-network hospital, but she saw an out-of-network provider. It's very confusing. It's like you can have a doctor that's out-of-network, but it's in the hospital that's in-network. And there was a new legislation that just came into effect. It's called the No Surprises Act, and where it helps protect patients when they get a surprise out-of-network medical bill. So we just told her about all the different things of how it violates the No Surprises Act. And then we were watching her as she was calling and telling them about this brand new legislation that just came into effect like 2 days ago. And then, they basically reduced her bill from like $500 to $25.
That's amazing.
And then I think those were all of these like different stories and moments is when we realized, oh crap, like we can really help patients with this.
I mean, you're not just helping out their wallets. You're helping them potentially have faith in a system that allows them to go to the doctor more often when they need to as well, and also creating a healthier world in that. So it's not just even about the saving money. If you really think about, the psychological impacts of assisting them down the line, and the psychological impacts that you could have on, everybody in the United States is affected by healthcare, right? Hundreds of millions of people could potentially benefit from this product. Given that, there's a large scale ahead of you, and that's amazing. We can't wait to see where it goes. What advice, though, would you have for someone that's just starting out in creating their venture?
Yeah, just dive in, like just get started, really. I think the scariest step was to fully commit myself and do it full time. But by committing myself and really just going all into it, I've learned a lot more. And then it's almost like this sense of, because I'm not hedging my bets, I don't have anything else, like I have to make this successful. And that drive can really push you forward and make you learn a lot of things along the way.
Don't hedge your bets. You
Just
don't need
do
to.
it. Mm-hmm.
That's a great lesson. I love that.
Mm-hmm.
And final question, looking back at your journey so far, if you had to change one thing about your journey, what would it be?
I think that there are a lot of things that I would have changed to make myself get to the point that I am faster, because I've learned. But I think that I'm only here now also because of all the lessons that I've had in the past, and like the ups and downs of things not working and then learning through it, even though it was really inefficient. So yeah, I guess I like wouldn't really change everything. I know that that's like something that you get a lot.
It's all good. It's all good.
Because like that's what's gotten me here today, and I'm very happy with where I am today. But yeah, I've never really regretted it ever when I just followed my gut for different things. I think that sometimes when I overthink things, I'm like too in my head and like thinking about all the possibilities and in an analysis paralysis. That's when, yeah, I'm never able to make a decision at the end of the day because of like a fear of failure or fear of imperfection. So I would say if there was a lesson, I would follow my gut and to stay focused on the things that are important to you.
And when you have a mission for a business that is as defined and as important as yours is, I think it's easier to stay focused. I mean, you know what you're trying to accomplish. You know that there is a light at the end of the tunnel for patients. You see it. You create it through artificial intelligence. It's really fascinating what you're creating here at Truffle Health, and we've been really glad to have you today. Thank you so much for being here, Rui. We really appreciate it.
Thanks for having me.
We encourage everybody to learn more about Truffle Health and learn about their journey and to support it. Before we end, do you have anybody or anything you would like to plug to our audiences?
Where can people find you? Who do you want to shout out?
Yeah, you can find us at just truffle.health. Just put it in your web browser. And then we were Truffle Health also because we sniff out the errors and the good stuff on medical.
Okay. All right.
Just that you know. And then, yeah, I want to thank my co-founder, Christian. I couldn't do any of this without him. Also, a bunch of our advisors from Cornell who supported us. We weren't able to do this journey if we didn't have our advisors from there. And then now we're part of a new Blue Ridge Labs team, so just shout out to them, and then also Bank of America Blue Breakthrough Labs program. So shout out to everyone who supported us.
Thank you once again. Thank you, Rui.
Thank you, Rui.
Thank you.
Congratulations.